Hi guys, I'm presenting on separation anxiety disorder. So what is separation anxiety disorder? It is excessive anxiety before, during, and even after separation from a parent or another attachment figure happens. Some normal separation anxiety would be mild distress, clinging, a little nervousness. They're sad when you're gone for a while, and even maybe crying for short times during and after the initial separation. So if you think back to the first time maybe you dropped your child off at school or daycare, they may have cried for a little bit and they were sad when they were gone today or when you were gone that day, and they were clinging to your leg. They didn't want you to leave. But you left and you came back and it was totally fine. And that type of anxiety generally subsides between 3 and 4 years old. However, a child with separation anxiety disorder would excessively worry when a separation from a major attachment figure or home is imminent or occurs, meaning that they're going to worry that their parent is going to get injured or die or never come back. Or they're worried that someone else is going to come and pick them up instead of their parent and kidnap them. Those are some things that would be going through their head. It can also manifest itself in other ways, such as nightmares, temper tantrums, and also some physical symptoms. So physical symptoms could be something like a stomach ache or a headache, or even as extreme as vomiting. And that's really in an extreme case. In order for your child to be diagnosed with this, it has to be done by a professional in the psychiatric field. So your primary doctor or pediatrician would refer you to a psychiatric clinician in order for them to be able to make the diagnosis. And in order for them to make the diagnosis, the child must display 3 of the criteria or symptoms for more than 4 weeks. And the list of criteria is actually regulated by the American Psychiatric Association. I didn't include all of the different criteria or symptoms here because the list is quite extensive. But whatever symptoms the child does have must also be causing significant impairment of normal functioning, such as social and academic. So if the child's excessive worry is hurting their day-to-day functioning, like preventing them from going to school or preventing them from eating breakfast, preventing them from doing normal daily functions, then that would be something that could lead to a diagnosis. Some risk factors and possible causes for separation anxiety disorder would be a stressful event. So someone died, the parents got divorced, a move very far away, those types of things. Also, a parent that has anxiety or other mental instability, like depression, those parents are more likely to have children with separation anxiety disorder, just because the parent has a hard time coping with anxiety, and which means the child will most likely have that, have a hard time coping as well. Also, lack in environmental stability. So if their environment is kind of crazy and not predictable, that can cause anxiety as well because they never know what's going to happen next. If they're developmentally behind, that's another reason. They would feel anxious because they see their friends or other people their age, other children their age, able to do things that they are not able to do. And lack of quality parental attachment. If the attachment between the parent and the child is not enough, then they could be afraid that their parent's just going to leave because they don't have a quality attachment there. Also, it could go the other way. The attachment is so strong that they don't want to be without their parent. So those are some risk factors for it. Some prevention ideas that a parent can do for separation anxiety disorder are make sure that the attachment to their child is secure, so they have a healthy relationship with their child. Providing a stable and safe environment, having a consistent schedule is a very key component for having a stable environment. And a safe environment. The child isn't at risk of getting hurt or injured, and the parent isn't as well. If, for example, they live in a home with domestic violence, that's not a safe environment for the child, and the child could develop anxiety because they don't know if them or their mother or other parent is going to get hurt at any time. And modeling positive reactions to anxiety, not only the parent like handling their own stress and anxiety in a positive way, but also like playing with dolls and role playing and saying, oh, Barbie's dropping off her child at school today. And the child's really happy to be at school because they're going to do lots of fun things. And the parent's going to go and do this and this and this and come back and pick the child up at the end of the day. And they're going to be so happy and they both had a great day. So those are some great tools for the parent. As far as school interventions go, knowledge is power. Getting as much background information from the parent about what their home life is like, and making a plan for starting school with the parent is great too. Setting up a schedule and having predictability. A visual schedule is a great tool for a child with separation anxiety disorder, because drop off is definitely one of the hardest times. That's a big all transition times are hard for children with special needs, but especially the drop off time. That is a very anxious, a time where anxieties can occur. And having a schedule for that time and having a consistent routine at that time is very key for the child. First, you put your backpack away, then you hang up your jacket, then you go to the table to do an art project, or you have circle time, or whatever the schedule is. And having a comfort item from home if the child's having a really difficult time, like a blanket, a stuffy, a toy. And the parents and the school can work together to also identify triggers. And this doesn't mean so that way you can avoid the triggers. It's so that way you can slowly, using baby steps, expose the child to the triggers so that way they can learn healthy ways of coping with that anxiety. Because the goal is to give them coping strategies so they can do their daily tasks without being anxious about it. And having distractions and keeping the child on task throughout the day, like it will help them be able to not focus on their anxiety and focus on something else instead. This doesn't mean at drop-off time that, you should distract the child so the parent can sneak away. That's definitely not a good thing. That will actually amplify the anxiety or the fear that the child has that their parent can disappear at any time. Having the distractions is to keep them from thinking the negative thoughts of being kidnapped or their family being harmed. And that could be like an art project, like let's make a gift for mom so when she comes to pick you up, we can give it to her. A great thing to do. Also, positive reinforcements for independent behaviors. Giving them attention for something that they did good, for not being anxious for something. That is a great way to help the child. Therapy is something that the child will most likely be referred to or have as a treatment. It's the most common form of treatment, psychotherapy and cognitive behavioral therapy. Obviously, therapy is much more effective when the parents are involved because educating the parent on the coping strategies that the child is learning means that the parent knows how to assist the child in implementing those strategies, especially at this young of an age, because the child's going to have a hard time remembering what they're supposed to do. The therapy is very intensive and long, but it is very effective as well. And I previously spoke about, exposing the child to their triggers. That's exposure therapy, and you can collaborate between the child, the parent, and the school. Meds are an option, but only if therapy is completely ineffective, and then you would use them together, not apart. So, these are all, the big thing to remember is that all of these things that you're doing for this child is giving them the tools to cope. It's not going to eliminate the anxiety. What it is giving them the tools to cope with their anxieties in a healthy and positive way instead of the negative ways of throwing tantrums and etc. And then I have some references and some more references and some more references. So thank you.